Hello, everyone. I am Rob Rogers, President of School Health Corporation and Board Chair of Healthy Schools Campaign. I'm very pleased to welcome you to Change for Good on behalf of Healthy Schools Campaign's board and staff. I want to thank all our sponsors for making Change for Good possible, including Advocate Children's Hospital, our presenting sponsor, our gold sponsors, GCM Grosvenor, Northern Trust, and School Health Corporation. Silver sponsor Inseparable, bronze sponsor Barrera Health Group, and champion sponsors Clune Construction and Pamela Self Landscape Architecture. Healthy Schools Campaign is dedicated to making schools healthier places for all children. And next year, we will be celebrating 20 years of this important work. We are based in Chicago and work at the local, state, and national levels with parent leaders and other school stakeholders on a range of issues connected to health and equity. Today's Change for Good Forum is focused on the student mental health crisis in our country. I am proud of the work that Healthy Schools Campaign is doing to shine a spotlight on this issue, and we are pleased to have hundreds of parents, community partners, and leaders from the fields of health, education, and public health here with us today. We have hundreds of people from around the country with us today. If you want to say hello, where you are from, please do so in the chat. Today's event will include a Q&A with our speakers. If you have any questions that you want to submit, please do so in the Q&A window on your screen. We may not get to every question, but we will try. Today's event is being recorded. Now, I am pleased to introduce Rochelle Davis, Healthy Schools Campaign's President and CEO.
Well, thank you, Rob. And thanks for all you and other board members do for Healthy Schools Campaign. The last 2.5 years have been intensely difficult for school children. Before the pandemic, children already struggled with a variety of mental and physical health issues that impacted their ability to learn. The pandemic intensified these issues, causing soaring rates of school disconnection, trauma, anxiety, depression, and suicide among children and youth. The pandemic also widened the already glaring disparities in the kinds of support and services that were provided in schools serving low-income Black and Latinx students. COVID dramatically highlighted the role that schools need to play in healthy learning environments and created an unprecedented opportunity to re-examine health and education policy. However, as the pandemic fades, there is an emerging counter-narrative around a return to normal. We need to engage stakeholders and policymakers around education and health policies that center equity. We must avoid returning to a pre-pandemic normal that failed so many children. Healthy Schools Campaign works across sectors at the intersection of health and education, looking for ways to bring policymakers and practitioners together to create the solutions that children need. Our hope is that through this event, we can launch some important conversations about how school districts, state leaders, and federal leaders can work together to support children's mental health. We are excited to welcome Katie Deely from the U.S. Surgeon General's office and Roberto Rodriguez from the U.S. Department of Education to listen and respond to the state and local solutions being discussed today. Right now, there is a wave of national investment in addressing children's mental health, and we are pleased to be part of the emerging national dialogue about how schools can create learning environments that support these needs. In a few minutes, you will hear from Heather Wines, who will talk about some of the strategies she is using at the district level in Virginia to help schools support mental health and resilience. And from Jaydeen Chow, who will talk about the efforts in Chicago to rethink school policing as part of an overall effort to support student well-being. Of particular interest to Healthy Schools Campaign is the focus on expanding Medicaid-funded school health programs. We have been working for more than a decade on federal and state policy change to allow school districts to receive funding for all health services they deliver to Medicaid enrolled students. During this event, you will also hear from Eva Stone about her leadership in expanding Medicaid-funded health service in Kentucky schools. As part of the recently passed Safer Community Act, the federal government will be releasing updated guidance to help schools expand their school Medicaid program and provide additional assistance through a $50 million grant program and establishing a technical assistance center. This support is much needed, and we look forward to working with the federal government on implementation. We want to make sure that these funds are meeting the needs of the vulnerable students in a way that is culturally appropriate and that longer-term systems of support are being created. And while we are glad that the federal government is making student mental health a priority, we recognize the need for states to also play a strong role in supporting school districts to provide comprehensive mental health programs. That is why we've been working with Mental Health America to develop a new resource to help state leaders understand their role in addressing the mental health crisis and the opportunities available to implement high impact and informed policy solutions. Even as we work at the national and state level, we always root our work with students and parents and with a focus on equity. Now, I would like to turn this over to our Community Engagement Manager, Kenneth Bardner, who will talk about our work with parents and caregivers on this important issue.
Thank you, Rochelle. Hello, everyone. I'm Kenneth Warner, Community Engagement Manager at Healthy Schools Campaign. Healthy Schools Campaigns believes that children must be healthy in order to thrive and succeed. And we know that any true definition of health must always include mental health. Through our work with parents and caregivers, we have heard firsthand about the mental and physical toll that systemic racism and generational trauma exact on families. Parents and caregivers remind us that issues surrounding food insecurity, nutrition, physical activity, anxiety, violence, and environmental justice are all linked together and cannot be addressed in a vacuum. Since 2004, parents and caregivers with HSC support have led health promoting change at more than 50 schools and influenced the district on major policies, including reinstating recess and PE, improving the school meal program, and much more. Parents and caregivers also remind us that policies aren't enough. They must be linked with programs that improve the lives of students, families, and school staff. One great example of this is our Space to Grow program, which creates green schoolyards at Chicago Public Schools using a unique community-oriented design process that brings parents and caregivers together with community members, school staff, and students to share their needs and priorities. The schoolyards have playgrounds, running tracks, sports fields, and gardens, but most importantly, they are safe and restorative spaces that can be utilized by the entire community. Studies show that access to green space and outdoor play during the school day are associated with improved focus and academic performance, and a daily connection with nature supports mental health. In a year with so much stress and loss, especially in Chicago's most disinvested neighborhoods, these spaces are invaluable. I am proud to say that we're about to complete construction on our 34th schoolyard in the next few weeks. We are also interested in addressing the student mental health crisis in more direct ways. Our parent leaders have raised this as a priority, and strategies around social emotional learning and restorative practices have become part of our Parent Leadership Institute. There is an urgent need for our school-based mental health services, and we are engaging parents and caregivers to learn more about their experiences and ideas on how to support student mental health most effectively. When parents and caregivers feel engaged and informed, they are able to advocate at the school level for the support their children need. Now we'll hear from our panel of local experts who will share what they are doing in their schools, districts, and communities to prioritize the mental health of students. Our first speaker that I'd like to introduce you to is Eva Stone. Eva is the manager of district health for Jefferson County Public Schools in Kentucky, who led the charge on Medicaid expansion in her state. Eva?
Thank you. Welcome, everybody. I am speaking directly about expanding Medicaid services. What was mentioned about reversing the Medicaid free care rule that used to limit billing to only students who had an IEP and had disabilities in their IEP, to allow for increased billing for services for kids who don't have IEPs. And that would include for mental health services and physical health services. And so that's some of the work we've been doing in Kentucky. And that all started in 2014. CMS or federal Medicaid issued a letter that their interpretation of that regulation, they changed their stance on that, which allowed for districts to expand the billing that they were doing. But states typically have in place state policy related to Medicaid billing that would limit them to just bill for those things that were in students' IEPs. So across the country, school districts can't automatically just take place in this expanded billing. What we did in Kentucky, first of all, I was in a small district and they were in the process, the Board of Education was in the process of reducing the salary of all the nurses that had been on staff due to budget constraints. And they cut their salaries so dramatically that they ended up all resigning. But as that was happening, I was frantically looking for ways that we could figure out how to sustain our program. And so I began searching for more information about Medicaid billing. And I came across a webinar the Healthy Schools campaign had done, and watched the webinar, learned more about Medicaid billing, stalked the people who did the webinar, which was Alex Mays with Healthy Schools campaign and John LaCour from Louisiana, and just managed to find them and get in touch with them and start asking them what they were doing in their states. I reached out to some of our state advocacy groups. Two groups in particular that I reached out to was Kentucky Youth Advocates and then our Kentucky State Nurses Association, to talk to them. And, you know, Kentucky, if you've never looked at the rankings for states and health, Kentucky tends to lead the nation in poor health outcomes, despite Herculean work that's been happening for years and years. So when we keep doing the same thing and don't see improved outcomes, then it's time to do things differently. I left that small district, came to a large urban district, but still in Kentucky, and we continued to work on this effort. Unfortunately, what happened next was we had a school shooting in the state, and that increased the attention that legislators were paying to mental health services in schools. And so what began as they formed a committee that traveled around the states to hear from people, and what started as Kentucky talking about arming teachers ended up with them forming some very good legislation to strengthen mental health services in schools. And that also included work on Medicaid. And so in April of 2019, the state submitted a state plan amendment. Several of us in the meantime spoke to legislators, went and testified with the safety committee, talked about this expanded Medicaid billing. And so the state submitted that state plan amendment in April of 2019. The federal Medicaid approved it in November of 2019. And then, of course, the pandemic came. And so, as was mentioned at the start of the webinar, there were some structures put in place to help respond to the pandemic, but also revealed some incredibly stark disparities that we knew existed, but maybe not the extent. So we were fortunate to implement an electronic health record to help with COVID monitoring, but through that record, we've been able to monitor health disparities much more closely. For example, we know by school the percentage of students who are double vaxxed against COVID, and that ranges from 4% to 84%. And those numbers coincide with race and poverty level. The higher poverty schools have lower percentages of students vaccinated. Those sorts of things are some of the data we've been able to collect, and we don't want to lose those systems. So the Medicaid billing has become even more important. Now what we're doing more moving forward, our Kentucky Nurses Association has had prioritizing getting nurses in schools for the last several years. We have a work group for school health services, and so we are now doing surveying districts across the state, looking to see who's implementing the expanded billing. We've developed a community of practice that will be meeting once a month And we will use that platform to speak to not only school nurses to empower them to know about this Medicaid billing and how to better implement in their districts, but it will be open to other school-based health providers, mental health folks, those people who are working directly with students and families and who know what those needs are. I'll turn it back to you, Kenneth.
Thank you, Ava. As a person that works directly with community members, it is great to hear what you have going on the state level. It is very much appreciated. Next, I would like to introduce our second speaker, which will be Heather Wines. Heather is the supervisor of social emotional learning for Prince William County Schools in Virginia. And she'll talk to us about her district, how her district is prioritizing social emotional learning and student and staff wellness.
All right, thank you so much. Thanks for having me here with you all today. As mentioned, my name is Heather Wines, and I serve as the Social Emotional Learning Supervisor overseeing our PWCS HEALS initiative within Prince William County in Virginia. I'm here today to talk a little bit about that particular initiative. So HEALS came about as a result of the COVID-19 pandemic. Our Director of College, Career, and Student Support drafted a plan to utilize ARPA funding to create programs that would support the mental health and well-being of our students and staff as they began to transition back to in-person learning. HEALS has three major programs: social emotional learning, healing-centered engagement, and support core. We began developing these programs full-time around December of last year. And we've also been lucky to have a superintendent, Dr. Latanya McDade, who has been tremendously supportive in our efforts and who saw this as a priority and integrated our work into our division-wide strategic plan. Our SEL programming is focused on increasing social emotional learning, both implicitly and explicitly for our students and staff. Because of our partnership with Kaiser Permanente, we began a collaborative relationship with Healthier Generations, who helped us begin our work with social emotional learning, specifically with using the Thriving Schools assessment and training staff around well-being. We currently have over 250 SEL coaches who are school-based staff working directly in our schools as a supplemental paid position. These staff members vary from teachers to school counselors to librarians to even information technology coaches. We also have about 50 SEL coaches within our central office that support the adults who are in various departments supporting the work that is occurring in our schools. All of our coaches continue to go through professional development to then provide their schools or departments support, resources, tools, and best practices for implementing social emotional learning. Within our Healing-Centered Engagement program, we have trained over 80 school-based mental health staff to become what we have identified as HCE specialists. These individuals have been trained in practices around the implications of traumatic experiences for groups of individuals and how to begin healing as a collective group. HCE specialists are also trained on trauma-informed practices. Our HCE specialists created a teacher training that was provided last year to over 4,000 of our teachers to gain additional knowledge around trauma and the impacts trauma has had on our students, themselves, and our communities. This year, they are working on providing continued support to schools through additional professional development on universal precautions in the classroom and connecting trauma to social emotional learning. Universal precautions can be both academic and non-academic. Many of these things our teachers are already doing, but we want to enhance their understanding and make these practices more purposeful. Things such as being informed on recognizing behaviors that may be as a result of a traumatic experience, practicing grounding techniques or including movement breaks within their lessons, and examining the language that we use when communicating with our students and families. And finally, our Support Core program is our Tiered 3 approach to supporting our students who are struggling with school re-engagement. We've trained school-based mental health staff on Support Core team members who work with students and their families for up to 10 hours outside of the normal school day. Support Core team members are focusing on providing short-term, intensive support in a non-clinical counseling manner that increases the student's ability to achieve academic success. Students are focusing on goals related to increasing school attendance, which could be impacted by a number of things such as relationships with staff and peers, trauma, grief and loss, or just simply being overwhelmed by academic pressures. Support core team members work collaboratively with the student and the family to set a foundation to continue gaining success for the school year by connecting them to community resources and building relationships with adults within the school building. Our support core team members are also working collaboratively with our attendance team to reduce the amount of students who become chronically absent and are also at risk for dropping out. So as you can see, our HEALS initiative is a systematic approach to support the social and emotional well-being of our students and our staff. And in order for us to continue this amazing work, we need the continued support of our local, state, and country leaders to make this a priority. We all know that a student's emotional well-being is a vital indicator on how they will achieve academic success. Thank you so much for your time today.
Thank you very much, Heather. I find it so important. We all know it's very important to understand the trauma that students face, but it is so important that teachers understand that, as well as understand the trauma that they can be suffering from that impacts those relationships. So thank you very much for your work. Our next speaker is Jadine Chow. Jadine is the Chief of Safety and Security at Chicago Public Schools, who is doing the important and painstaking work of moving CPS away from a student safety approach that focuses on police in schools. Jadine.
Great. Thank you so much. Good morning, everyone. I'm so excited to be here. Before I dive in too far, I just want to share, I joined Chicago Public Schools in 2011. So I've been in here 11 years in this job. And I wanted to share that I am the first Chief of Safety and Security that the district brought in who's not from law enforcement. That's significant because the district really was making a concerted effort to change the paradigm of safety away from the idea that enforcement is how we're going to keep our schools safe, and instead make sure our schools are not only physically safe, but also, and maybe more importantly, emotionally safe. And so that really is the theme of what we're going to talk about today. But I wanted to share, to do that, and I think a lot of people already touched on this, it was so important to bring together our stakeholders. And who are our most important stakeholders? Our students. And so when we started on this journey back again in 2011, the first thing we did was brought students together, and we heard from them, what makes you feel safe when you're at school? And over again, no matter what neighborhood we were in, no matter what type of school we were in, we heard over and over, safety is about relationships. And so that is everything that we are grounded on in everything we do. And so when we think about organizational change, we wanted to make sure that everybody was on the same page. So this means changing mindset, the mindset of our district leaders, the mindset of our families, of our teachers, of our security officers, our nurses, our lunchroom workers, everybody. We have to be on the same page that we're going to be less about punishment, less about enforcement, and more about supporting our young people, and more about making sure that, again, they feel welcome. And so how do we do this culture? So we work with a lot of things you just heard from Heather. Dr. Latanya McDade was at Chicago Public Schools just prior. I'll just tell her I say hi. We miss her greatly. But it's about changing that culture. So a lot of the things you heard from Heather, PD, really making sure that we're engaging everyone and bringing everyone along. This is not just policy. This is about hearts and minds. And so since school year 2013-2014, we've seen a 78% reduction in our out-of-school suspensions for high schools and an 81% reduction in our out-of-school suspensions for elementary schools. We've seen over an 80% reduction in the arrests of students. And that leads to the conversation of how are we moving away from, again, making less about enforcement. In the summer of when we had the tragic incident of George Floyd and his murder, a lot of school districts were grappling. How are we going to deal with the police and schools conversation? In 1991, exactly 20 years before I joined the district, every CPS high school in the district had uniformed armed police officers in their school. That's a lot, and that's a big message. Over the years, we've seen our schools slowly and quietly saying, you know what, we don't need the police officers in the building. we need their support in the community where we have things happening. The schools are relatively safe. So quietly we started to remove them. But then again, during the summer, where we all across the district were talking about what happened with police in Minnesota, we began contemplating, okay, let's start being a little bit more assertive on what we're going to do with this. And so with the partnership of our board, we put together a resolution that said we are going to affirmatively move forward in a way that looks at the role of police in schools and ultimately replace police and the role they serve with what we have been trying to move towards, which is much more supportive and proactive safety strategies. And so to do that, again, in the spirit of making sure our stakeholders are helping us build where we're going, we engaged 5 community-based organizations. Some of these may be names that you might have heard of. Voice, which is a student-led organization. Kobe Power Pack, which is a parent-led community-based organization. MICVA Challenge, again, student-led. And then we had Arc of St. Sabina helping us representing the Southside communities, and Build Chicago helping us represent the Westside communities. We engaged thousands of stakeholders in building a process that we landed on, which is then called the whole school safety process. Whole school safety because it's holistic in how we're looking at this. This is not just about do we keep police or not keep police. It's about what do we do to make sure that we are encapsulating what truly safety means. And so in this process, we had school safety committees formed at the local level. And in doing so, each school was able to determine based on their data what they felt was right for their school, because not all schools are created equal. Not all schools are in the same place in terms of development. And so we wanted to make sure that schools were empowered to make that decision. So they were given a template, essentially a process to create these whole school safety committees, which had to include not only school staff and principals and teachers, but also students as well as parents. As a matter of fact, the directive was please center the voices of your students in everything you're doing with your vision. Out of this process, a decision was made. Do we want to keep police or do we want to trade those resources in and then replace them with reinvestment funds that would be used towards more proactive strategies such as restorative justice coordinators, climate development coordinators, deans, professional development, behavioral health teams, counselors. Schools had the option of doing that. So how did it go? At the end of the process, local school councils voted on their individual safety plans by the committees. And through the process, 69% of the schools, and these are high schools, decided to either fully remove all police officers or partially remove, meaning they went from 2 uniformed police officers to 1. So 69% did either remove or partially remove police presence. And in exchange, they received reinvestment funds in the amount of $3.8 million that were then used towards alternate systems of safety that I talked about a minute ago. So why are we so excited about this process? Is because it was community led and because it was driven by the stakeholders at the local level. Because we do it that way, we believe it's sustainable. And so all of that was started before the pandemic. And coming out of the pandemic, like everyone has said before me, we and everyone else around the country saw an unprecedented level of stress upon our children, upon our families, upon our schools. When things started happening upon return, we were in remote, we went back in person. When things started happening, so you had situations, we had a few crises. Some communities instinctively said, I want my police back. That is where their muscle memory went, because that is where their paradigm was that safety equals police. Now, our position was, and we set this as one of the guardrails on the front end, is you can't go backwards. Okay, so if you're removing your police, we're going to help you solve your safety concerns, but we're not going to add them back in. So be very considerate in your decision. So when we heard from schools saying, I think we made the wrong decision, I think we need our police back, we asked them why. What is the safety challenge that you're facing? What is the root cause of what you're doing? And we help them through that. So in partnership with our Office of Social Emotional Learning, so Heather's counterpart in our Chicago Public Schools, together in partnership with school leadership and our network leadership, we work together to solve those root issues. And at the end of each incident, if we needed to talk through that decision again, we always ended up in the same place, which is, yes, we did make the right decision. We're good, we're okay, and we're moving forward. And so when we look at it from a sustainability standpoint, our key takeaway is when we do authentic community engagement in a process like this, like safety, like school safety, we can't lose. This is the way to go. I am fully all in on this. Our superintendent, our CEO, Pedro Martinez, has been very supportive, 120%. Our Mayor Lightfoot here in Chicago has been supportive of this process. We're not turning backwards, we're moving forward. And every year we will continue to revisit the whole school safety plan to see what has changed. What has changed means moving forward and maybe reducing police presence further, not adding them back. But then we're also looking at everything from a data-driven perspective, which is how are we doing and where do we need to make improvements so that our children feel safe and welcome every day they come to school. And with that, I'm going to turn it back to Kenneth.
Thank you so much, Jadine, Heather, Eva, and Kenneth, for sharing all of the work that you are doing in your communities and states. As I mentioned before, Healthy Schools Campaign believes that it is essential to link efforts to support student mental health all the way from the school level to the national level. And I'm so pleased that 2 members of the Biden administration are here today to listen and reflect on how federal policy can support the successful local efforts we just heard about. First, we'll hear from Katie Deely, the Director of Engagement for the Office of the U.S. Surgeon General. Katie?
Thanks so much, Rochelle, and thank you all for having me here. It's a wonderful honor. As Rochelle mentioned, I joined recently in the Office of the Surgeon General to lead our engagement work. And I think it's important to note that Dr. Vivek Murthy is our 21st Surgeon General. He served in the role previously under President Obama. And his role really as the nation's doctor is to help lay the foundation for a healthier country, relying on the best scientific information available to provide clear, consistent, and equitable guidance and resources to the public. So I've been asked to share a few reflections from our panelists, and then to speak a little bit about the work that our office is doing, the Office of the Department of Health and Human Services and the administration broadly. And I think it's really important to note that it's really because of sustained work from countless experts, advocates, organizations, Healthy Schools Campaign, that we really are seeing inspiring and promising work at the local level that we heard about today, and true momentum across all levels of the country and the government. So first, my reactions to what we heard. In a word, it's wow. You know, it's really fantastic to hear examples of such promising work. As I listened to the panelists, it made me think about the commonalities, and I heard a few. One was just that all of the efforts are centered in the conviction of the importance of mental health and well-being more broadly, that they're centered in equity, that they are deeply student-centered, but also, and this is a great one to see too, that they are really thinking about the adults that are interfacing with young people. Thinking about the adults in terms of their mindsets, but also the support that they themselves might need in supporting young people. And last but not least, they're community-driven. So what does that make me think about the role of government? Well, I think it makes me think that at the federal level, we can certainly create opportunities to do exciting things, but the success is not if we create those opportunities. The success is really the incredible and creative work at the local level. So one of the things that jumped out at me is even when we see big changes, as folks mentioned, particularly around Medicaid, there can be big changes and that doesn't translate into big changes on the ground necessarily or automatically, right? That it can require incredible creativity and flexibility, whether it's to find different funding streams, to work through administrative policy, the sheer coordination often required to take advantage of policy change, resources that need to be advocated for, or capacity that needs to be added. And I think the piece that struck me most was how in all three of the examples, the panelists spoke about how people came together for this to work. So whether it was all of the Chicago stakeholders, which for those of you who don't know, I am from Chicago, so I can attest that is quite a Herculean effort to get all of those stakeholders together, right? And to really be together in leading a vision forward. Or whether it was the central staff that Heather mentioned that may not have been intuitive to others, that you would really focus resources on the central staff as well. Or finally, the community of practice that Eva mentioned, that these weren't singular ideas from one person. It was taking advantage of landscape changes, recognizing the need, hearing the voices of folks most affected, and figuring out ways to partner creatively to move forward to advance stronger health and well-being. So it's incredibly inspiring for me to hear, and I can't wait to hear Roberto's reactions as well. I'll pivot briefly or quickly to some of the work that we're doing in our office. So Dr. Murthy has identified youth mental health as a critical priority. And I think it's important to note that we talk about this across the country, not in terms of the pandemic. We start by some of what was shared earlier in making sure we're grounding folks in the recognition that our country has long struggled to address profound mental health challenges and illnesses in children, adolescents, and young adults. And that in fact, this was a crisis well before the pandemic began. And I think it's important to note that because I do have a fear, and I think our office shares this, that as people return to whatever their sense of normal or post-crisis of the pandemic, that this might recede from people's minds. And we take great pains to make sure that we are communicating at all times the data that shows the growth in the need and the crisis in the decade before the pandemic. We also know that the pandemic exacerbated all that we've seen, that it disrupted major elements in daily lives, and that those impacts have been most heavily affected the vulnerable communities to begin with. So whether that's youth with disabilities, LGBTQ, youth from low-income households, racial minorities, ethnic minorities, rural areas, immigrant households, child welfare, juvenile justice system, or youth who are unhoused, we know that the impacts have been far greater. And we also know that at the heart of our youth mental health crisis is a pervasive stigma. And so it's really our view and Dr. Murthy's view that we need change at all levels. We need it on the individual level, so kids who are reaching out, asking for help, adults who are working with them, as the panelists all noted, and each of us working together to build a culture that normalizes and promotes mental health. And we need help and action at all levels of government. This is something that Dr. Murthy has been working on for many years, including work with Healthy Schools Campaign from his prior stint as Surgeon General. So what have we been doing recently? Last year, our office released the Surgeon General's advisory, outlining policy, institutional, and individual changes it will take to reframe how we view, prioritize, treat, and prevent mental health challenges. So among the main recommendations, we're ensuring that every child has access to high quality, affordable, and culturally competent mental health care. A renewed focus on prevention by investing in school and community-based programs, and increasing our understanding of the impact that technology and social media has on mental health. The Surgeon General travels the country, meeting with young people, organizations, leaders, helping to draw attention to the critical work they're doing, just like the work that was shared here today. And we're seeing some real momentum. Last June, following the Surgeon General's advisory, a group of folks across technology, entertainment, philanthropy, nonprofit, came together and announced 75 new commitments from more than 30 organizations to promote and support the implementation of recommendations that were identified in the advisory. We're also seeing significant momentum at the state and local levels of government. The U.S. Conference of Mayors has created a task force on mental health. The National Governors Association has created a mental health initiative. And finally, there's a great deal happening at the federal level. As I'm sure many of you saw, President Biden put forward in his first State of the Union a comprehensive national strategy to tackle our mental health crisis and called for major transformation in how mental health is understood, accessed, treated, and integrated. This summer, the Biden-Harris administration announced 2 actions to strengthen school-based mental health and address the youth mental health crisis, awarding the first of nearly $300 million the president secured through the 2022 bipartisan omnibus agreement to expand access to mental health services in schools, and funding through the bipartisan Safer Communities Act. Additionally, this summer, our Secretary Becerra from HHS and Cardona from ED sent a letter to governors calling on them to invest more in mental health services for youth. And this followed a joint effort between HHS and ED launched earlier this year to expand school-based health services to ensure children have access to health services and supports. I'm going to leave it to Roberto to talk about the Department of Ed efforts, and I'll just close briefly with some quick updates from HHS. This summer, HHS announced a transition to the 988 suicide crisis line. Also this summer, through SAMHSA, the Substance Abuse and Mental Health Services Administration awarded over $40 million in youth mental health grants in August alone, including $5.3 million from the American Rescue Plan. In August, CMS issued new guidance, as Rochelle was referencing, reminding states of their mandate to cover behavioral health services for children in Medicaid. And earlier this month, HHS announced $47.6 million in new grant funding opportunities developed from the bipartisan Safer Communities Act, including AWARE, additional funds to AWARE, and $10 million for the resiliency in communities after stress and trauma. So I just want to close by saying it is so heartening to see the creativity, the collaboration, the conviction, and the equity that is driving work at the local level. It's heartening as somebody working for the federal government to know that that's in part possible. Our vision, your vision is aligned, that we want to see more young people able to access high quality supports, more adults who work with young people feeling supported, and all of this to help us get to a stronger, healthier place, not just as we come out of the pandemic, but moving forward. Thanks.
Well, thank you so much, Katie, for that presentation. Now I am pleased to introduce Roberto Rodriguez, the Assistant Secretary for Planning, Evaluation, and Policy Development at the U.S. Department of Education.
Thank you so much, Rochelle. And it's just such a pleasure to be here with you all on today's webinar. What a fantastic discussion and sharing of strategies and ideas for how we move all this work forward. I want to begin by really recognizing the Healthy Schools campaign and your leadership in centering the health and well-being of our young people, particularly as we emerge from this pandemic. That effort is important today more than ever before. You've been a tremendous partner with our federal and state and local leaders in helping to advance this charge. And we have today school nurses and social workers and school psychologists, school counselors, mental health professionals, teachers, system leaders from around the country joining us. I just want to thank each of you for the important role that you play in supporting the recovery of our students and our families in communities across the country. There is no question that this pandemic posed an unprecedented disruption in the lives and the learning and in the relationships that sustain our young people. And that has very clearly contributed to learning challenges and learning and opportunities for additional academic growth, for mental health gaps widening in our system for many young people. And as Katie has so eloquently noted, our Surgeon General has been such a powerful reminder of us all across the administration and of the country that we are facing a youth mental health crisis. It is impacting our communities in unprecedented ways. We know that youth reports of psychological distress have doubled since the pandemic began. We know that 60% of our LGBTQ youth who are seeking mental health services over the past year were not able to obtain those services. We know that more than half of our parents and caregivers are expressing concern over their children's mental health and mental well-being. So we really need an all hands on deck effort at every level in our government, from the local, the state to the federal level, to address this. And I'm just so tremendously inspired by the terrific panel that we just heard from today around some of the strategies and leadership that's underway at the local and the state level to move us forward on this charge. Eva spoke so well about the important work around expanding Medicaid and the important function that Medicaid serves in expanding school-based health services. Our secretary, Miguel Cardona, here at the Department of Education has a vision to build and provide a strong mental health infrastructure in each and every one of our schools across the country. We can get this done. We have an opportunity to get this done, and we have an obligation to get this done. And so much of that means moving that big boulder around Medicaid billing that the Healthy Schools campaign has worked on for so many years, and so many of you have worked on in your local communities, moving that boulder forward, doing more to advance those strategies for our administrators and our school leaders to be able to access that funding to build that infrastructure. You know, Katie mentioned the letter that Secretaries Becerra and Cardona just issued back in July. And we're committed to doing more to provide additional guidance to help support our districts and our states in advancing access to Medicaid. That's one piece of the equation. We know we need to do much more. Heather so eloquently spoke about her leadership in Prince William County and the HEALS initiative. Congratulations, Heather, on your leadership. You have a great leader in Latanya McDade. I've worked with her in the past from her days in Chicago. She's fantastic. But I'm so excited about the efforts that our districts are undertaking to provide greater access to mental health support professionals and trusted adults who are trained to conduct health assessments, identify our students who have mental health needs, begin to set the table around those early interventions, provide that social and emotional support that we know our young people and our children need to be able to thrive, SEL coaches and opportunities to center also educators in this work. Our teachers have experienced such a tremendous challenge in this disruption brought about by the pandemic. And as we've moved as an administration from 46% of our schools open for in-person learning when we first took office to all of our schools open today, we know that those relationships and those connections are what will fuel the recovery and the support for our students. But we also know our educators need additional tools, strategies, supports to meet those social and emotional needs that they're seeing show up in their classroom in ways they haven't seen before. Those manifestations of trauma and of compounded needs around health that they're eager to address but need support to address. So I just want to thank all of our panelists for their commitment to that. Janine, I just want to really applaud your leadership in CPS as a national model, honestly, in really confronting the shift at the district level to really think about more restorative practices and affirmative practices that really help to raise our young people up and support their success. And so much of that is tackling some of these challenging conversations around police presence in our schools and how do we think about more positive behavioral supports and interventions. Our department here at the Department of Education has a National Technical Assistance Center to support positive behavioral supports and interventions and to help our districts make that evolution to really from punitive practices to more culturally affirming and restorative practices for our young people as we address some of the discipline challenges that we see throughout our system. That is I think you said it so well, that is a heads and hearts and minds piece, just as much as it is about our policies in our districts. And, we also have great leadership in Illinois, Senate Bill 100, which passed 4 years ago in Illinois. And I know so many educators worked on that to eliminate the disparate impact of suspension and expulsion in schools across that state. We still know our Office of Civil Rights tracks this closely. We still know that our students of color are disproportionately subject to those suspensions and expulsions that we know too often lead and fuel a school to prison pipeline, rather than helping to support those restorative practices to help them succeed and to lift them up. So we have a lot of work to do there, but just want to thank you for your continued leadership, and for Dr. Martinez, who's a wonderful leader and friend. I want to just highlight very briefly 3 things that we're doing here and areas of focus at the Department of Education to help support the cause and advance the charge from the federal level. The first continues to be the continued investment and focus on the American Rescue Plan, which has fueled this recovery across the country. $122 billion allocated to all 50 states to help our schools safely reopen, but also to address, of course, some of the challenges of lost instructional time, but also to support the social, emotional, and mental health needs of students. We have seen a 53% increase in our social workers in schools, an 18% increase in our counselors in schools as a result of the ARP investments. And we found our independent experts are estimating about a $4 billion spend down of that $122 billion just initially already on mental health services. We want to move more urgently in making sure that every district is doing an assessment to look at the needs for social and emotional and mental health for their students as they're looking at their ARP spending plans. The secretary will be actually today in West Virginia, further highlighting this important effort. The second thing I want to highlight is around supporting the president's goal around doubling the number of school-based health professionals in our schools. This was something that the president highlighted and prioritized and recognized the need for, just as even before coming into office. We know that our students are 6 times more likely to receive the mental health services that they need when they're delivered in educational settings. And so we have an obligation to build that infrastructure out. We are so pleased to be able to move forward in announcing earlier this summer $300 million in new awards to hire more school-based health professionals. Those applications are out right now for our school-based mental health services grant program, competitive grants to our local school districts to help surge that pipeline, as well as to the mental health services professional development grants program, which helps to support innovative models with districts and universities and others partnering to build that pipeline and improve the preparation of our mental health professionals to be able to take on that charge in our schools. That's an important part of the national mental health strategy that the president outlined earlier in his State of the Union address, as Katie mentioned. And then finally, I'll just highlight the importance of the Bipartisan Safer Communities Act. BISCA is a landmark piece of legislation in its focus on providing over $1 billion to support education efforts around school-based health and school safety. And our administration is eager to advance that charge. This week, we will be announcing to states their allocations under the BISCA legislation. And our administration is working hard on guidance that will provide to state leaders to support and lift up some of these mental health services and evidence-based approaches, early intervention, opportunities to do more to create the positive school climates that we know our students need to affirm and support their success and to help them thrive. None of this is possible without your leadership. This is an all hands on deck moment and effort. Our federal government stands ready to partner with you. We're partnering already together, HHS and ED and so many other federal agencies. We look forward to continuing to work with you and with the Healthy Schools campaign to get it done. Thank you so much, Rochelle.
Well, thank you so much. And we have not enough time for questions from our group. I'm going to very quickly summarize some of the questions and share how we'll handle them. We had a lot of questions for Eva with a lot of really technical questions about how do you really expand Medicaid funded school health services. And I think that really enforces Katie's point that sometimes it's just not changing the policy, and that changing the policy is not just sufficient, that there needs to be a lot of training and support. And so Healthy Schools Campaign advocated for a technical assistance center to be set up to provide that support on an ongoing basis. And we're so pleased it did get part of the Safer Communities Act. But in the meantime, Healthy Schools Campaign supports the Healthy Students Promising Future Learning Collaborative, which is providing exactly all of those detailed questions. And Eva has been a participant and a leader, and we have tons of people with her experience available to help all of you. So in the follow-up communication, we will share information with how you can connect with the Healthy Students Promising Future Learning Collaborative and join us in making sure that this policy is really gets down to the student level. The second thing is there were some questions about how do you get additional information about some of the grants, the federal grants and programs that both Katie and Roberto mentioned. And again, we'll make sure that that information is shared in the follow-up communication. I am hesitant to even throw one question out because I think we'll run over time. But I guess Katie and Roberto, I would love to give you the opportunity to ask a quick question of our state and local panelists, if you would like.
Roberto, I can jump in and just say, I would love to know if there's one more thing that you want your partners at the federal government to know that would be most helpful to communities and leaders on the ground. What is that? And I'm sure it is much longer than we have time for.
So JD, do you want to go first?
It is much, that's a long question, long answer. You know, I am so excited for everything that Roberto talked about and you talked about, Katie, and I'm interested in learning more. I think that one of the things that I've been here long enough, I remember, I'll say 2 administrations ago, where we actually had a really close partnership with the federal government. So we were actually, schools were flying out together and we were actually collaborating in DC. If there was a way to reopen that possibility, it really drove safe and healthy schools, and we made networks connections that way. So we can talk offline of what that looked like before. I missed that. And I know many of my colleagues who I still keep in contact with, for those who are still there. That was a really great way for us to share best practices in a very analytical and data-driven way. So thanks for giving us the opportunity of pulling us together today, both Roberto, Katie, and the Change for Good team. So I just want to say thanks while I had the floor.
Eva, really quick answer to a lot. I know there's a lot to say.
Sure.
that we
Well,
want.
what I would say is to look at those issues related to FERPA and HIPAA that are barriers to states, especially as we are looking at health equity and giving us the ability to work with our healthcare partners so that we can start looking at things like electronic health records in schools that can get, you know, there are states who've done view-only access for school nurses, for example, to have access to medical records, and we'd like to be able to do the same thing, vice versa. And then the other is to look at the issue of consent for the expanded Medicaid billing, because that FERPA HIPAA question is a problem. And technically, when folks sign up for Medicaid, they are giving consent for these services to be provided. So that additional consent that's being required, at least in our state and most states, is a barrier.
And Roberto, just so you know, we have been in touch with some of your team about that parental consent. Would love to see some motion on that. And I did not put her up to that.
It's a very active conversation here at Ed, Rochelle. Thank you.
Okay, great. And Heather,
Thanks, Eva.
any final?
I just want to Yeah, I just want to echo what Jadine said. You know, having opportunities to collaborate that is beyond just your local and your state partners is a really great thing and opportunity because we can learn from one another instead of having to recreate wheels. So that collaboration, so if that can be something that you guys are supporting, that would be phenomenal. That's how we get to know what's really out there and what's happening.
Well, thank you. And unfortunately, we do not have any more time for some of the questions, and we'll figure out how to get them to partners and connect the people who ask them and get that information out. I just want to end by saying, you know, over 20 years ago, I started Healthy Schools Campaign on this really simple common sense notion that healthy students were better learners and that we should all incorporate health and wellness into every aspect of the school day. And I never expected the level of complexity, barriers, challenges that exist. And I'm very proud of the role that Healthy Schools Campaign has played in breaking down silos, creating partnerships between agencies at every level of government, and really empowering school nurses and parents and principals and so many others to have a voice in this. And we are really, you know, at an important inflection point where the nation is aware of the problem of student mental health and wellness. Our federal government is aware of this problem. Both blue states and red states are looking at this problem. And I just want to thank everyone who joined us today and for all the work that you're doing, and look forward to continuing the dialogue and the partnership as we move forward. A special thank to our speakers for this dynamic conversation. And once again, thanks to Change for Good sponsors and the Healthy Schools Campaign board and team for all you do to make healthy schools healthier for all students. And have a great day. Thank you.